Welcome back. We've got part 2 to this little study session series situation that I'm trying with you guys. Creating a couple of videos to give like a baseline or like of some tips and advice on how to prep for an intern exam or any other pharmacist exam for that matter, whether you're a student, intern, or pharmacist doing extracurricular studies, pharmacist prescribing, the PharmD, that kind of thing. But yeah, essentially last video, part 1, we covered like the baseline of patient questioning, like effectively getting information out of your patient. And today is going to be another little short, sharp, quick session on how to effectively communicate the information that you're needing to convey to the patient in your oral exams. So yes, just some tips, tricks, things that I run through with interns over and over again over the last couple of years that I've been working with them. So yes, once again, if you're a student, listen in because you're going to be doing exams. You're going to be an intern one day. If you're an intern, listen in because this is directly applicable to you. And if you're a pharmacist, still worthwhile listening in, especially if you are working with a lot of students and interns, whether you're a preceptor or somebody that just supervises or likes to work with students and hold that sort of like more leadership role or leadership style. It can be helpful just to see what other pharmacists do to help support the people coming through under them. My little updates for the day. I actually feel like I've had a really productive day. Today is a Monday for me right now, and Mondays can go either way. Mondays can either be like get on top of your stuff and like start the week strong, or it just go absolutely out the door and you get nothing done and then you're backlogged for the rest of the week. So today was a good get your stuff done day. I can't tell you how many emails I cleared, but that was fantastic. And yeah, like a few other bits and pieces, quite a lot of like clinical interventions, talks with the doctor, working with the doctors. Lots of appreciative doctors and GPs today for, I guess, the things that I sort of like raised or suggested, which they were like, oh, that's actually a really good point, let's do that. And I was like, cool, this is exactly what I can do for you to sort that process out. Yeah, I think it's just nice that I feel like in rural healthcare particularly, everyone has like a really good respect for each other and what they do and what they can offer and the advice or the information and recommendations that they have to give. So yeah, spent a lot of time chatting today. That's really all I have an update on because I'm actually flying again out of Karratha tomorrow afternoon, as officially leaving in less than 24 hours. And yeah, once again, not a single item has been put in the suitcase. I don't even think the suitcase is still in the cupboard. So that's as far as we've gotten. Hence the caffeine kick as well, late at night. Yeah, let's get to it, shall we? Welcome to study session number 1, part 2. So in the last part, we've already covered how to effectively question or get information out of your patient. Now, I have been harping on about the importance of having good structure, particularly through your questioning. The exact same applies for your counselling as well. And today we're going to run through the structure that I used once again through university, and that has been filtered through in my intern year, and it is the exact same structure and counselling tool and technique that I get the interns coming through to use as well. What is this structure, might you ask? This time our acronym is called IDARL, standing for indication, dose, adverse effects, referral points, and lifestyle points. A cute little 5 easy quick step system to getting the information out to the patient that you need to also hit all the marks. Again, the reason why I recommend a really good structure, when it came to the questioning, it was to essentially keep you on track to ensure that you've asked all the necessary questions so that you're able to find the problem and diagnoses better. But when it comes to counselling, what I tend to find, what I've seen many students do, many interns do, and it can happen every now and again in practice as well, is that we get to the point where we figured out what the problem is and we go, yes, all right, perfect, sorted, done, let's get this out the way. And people start rushing the counselling section to literally just like get themselves out of the exam, which is totally understandable, but you miss a lot of marks because you haven't really spoken much to the patient about, the actual medicine that you're providing in this case, which is just as important as questioning them in the first place. Using this structure, indication. So indication should be about what this medication is used for an over-the-counter case, why you're recommending this medication, how it works, the mechanism of action that will make sense to the patient and the reason that they're needing it, and the basis behind why you feel it will be helpful in their case, using those explicit things that they have told you to say, you mentioned this and you mentioned this, and therefore it's going to be really helpful for this and this because this is how it works. So we actually can go really in depth, particularly for the over-the-counter section. Like, giving an indication is sort of like the key start to your counselling, and it's obviously like a huge component of the OTC section is picking a product and telling the person how to use it. With that, I think of it as 3 steps in terms of the product that you've recommended, how it works, and why you think it's going to be a good product for them based off what you're diagnosing them with and why you feel that they have that diagnosis. So it kind of all fits into there. The next section is dose. So running through specifically what dose they have been prescribed, or in the case of an over-the-counter section, what dose you recommend them to do, giving any complexities, or maybe even talking about some expectations in terms of this is your dose now, but maybe this is what your dose might look like later and why that's the case. For example, things like your statins for cholesterol, we tend to see the dose increase over time because the benefit sort of sits around that 20 milligram, 40 milligram mark for most people. Or in the case of, blood pressure medicines, same thing, explaining we start you low to see how you tolerate it, avoid side effects and work your way up, which can then very effectively move you into the next section, which is adverse effects. And for this, I tend to think about what are the key common things for that patient to expect. And then when it comes to all the other little bits of side effects, or picking which side effects we should be discussing with the patient, which ones are relevant, my recommendation when it comes to, I guess, your more intermediate or rare side effects, the ones that have like little monographs in the AMH, so it'll be like rare side effect, listed this as, neuropathy, and then underneath they'll have a subsection about the neuropathy and give a description of what it looks like and why it happens or how it happens. That would be something that you'd mention, being like, this is a potential side effect. I don't think it's likely to occur to you, but it is something that you need to know that if it were, then you know what to do or where to go. So that's how I'd kind of focus on the adverse effects to talk about. And in the case of over-the-counter stuff, a lot of things don't have really much side effects to talk about. And so you can generally just say it's generally well tolerated. Simple as that. Next are your referral points. So again, this is really important because you should have asked a lot of questions to rule out differential diagnoses so that the assessor can tell that you know what you are and aren't looking for. And it's the same thing with the counselling. Like if, symptoms don't resolve, or if there's certain side effects, or, keeping the patient safe essentially is what it's demonstrating, to the point where you refer them to another practitioner, or particularly in the case of a lot of over-the-counter stuff, you can refer them to come back to the pharmacy. Say if it's a simple ailment that if it doesn't resolve, they can come back, we can try something else. That's a good referral point as well, because you also want to think of it in terms of, in practice, we don't want to be overloading the health system by referring them straight to a doctor for simple things that we can help as pharmacists. They don't necessarily need prescriptions for if one treatment doesn't work or doesn't help. And finally, we are talking about lifestyle points. As a general rule, based off what I've seen, particularly when it comes to student assessments at university levels, also for Pharmacy Student of the Year competition, they're looking for 4 lifestyle points at least. So if you can always think of 4 things in the back of your mind to run through with patients for any OTC case as well as all your clinical topics, you're going to get really good marks because you've given the patient a lot of information to help them on their health journey. So yeah, if you can get at least 3 to 4, depending on, time and how you're going, that's probably the best thing that I can recommend. And no, recommending a self-care card in CMI is not considered a lifestyle point. That is something entirely on its own that you recommend at the end of your OTC case or at the end of counselling on your prescription item. That's really all I have for you today, keeping it short, sharp and sweet. Like I said, thinking of these little sessions, advice sessions, study sessions, as things to just give you very short, sharp, succinct information so that you can learn a lot without being totally overwhelmed. Maybe the next one should be how to answer part B, because this is another thing that a lot of people fall short in. I think that might be the way to go, answering part B, the ethical legal scenario. So yes, I hope you're enjoying these so far. Let me know what you think. If you're finding them helpful, please let me know. If there's things that I've missed, please comment them, because that could be helpful for somebody else watching. Yeah, I'm keen to know whether this is something that we keep diving into. Until next time.